Welcome to Easy Medicine, where we break down high-yield medical concepts into simple, clear, and practical explanations for Step 1 and clinical learning. In this video, you'll go through real high-yield cases in statistics and epidemiology, including clinical trial phases, screening biases, statistical power, and key study design pitfalls that are commonly tested. These are concepts that many students memorize but don't fully understand. Here, the goal is to make them stick. If you're preparing for exams or just want to truly understand how to interpret medical research, this video is designed for you. Let's get started. Case 1. As part of the Food and Drug Administration drug approval process, a study is conducted to evaluate the clinical benefit and toxicity of a new drug. This drug is intended to be used in combination with standard chemotherapy for patients with recurrent glioblastoma. 50 patients with recurrent glioblastoma are enrolled in the trial. They are randomized to receive standard chemotherapy plus either a placebo or one of 3 different doses of the new drug. The results show a dose-dependent reduction in tumor size with all 3 doses. However, there is also a significant increase in adverse effects, including hypertension, muscle weakness, lymphopenia, and hypophosphatemia. Based on these findings, the researcher concludes that the middle dose provides the best balance between benefit and toxicity. The question is, which phase of the clinical trial does this represent? The correct answer is Phase 2. Clinical trials are divided into phases. Phase 1 focuses on safety and pharmacokinetics, usually in healthy participants, and does not evaluate efficacy. Phase 2 involves patients with the disease and evaluates efficacy, toxicity, adverse effects, and optimal dosing. These studies are typically small to medium in size and may include control groups. Phase 3 trials are large, usually with more than 300 patients, and are designed to confirm effectiveness and safety compared to standard treatments for regulatory approval. Case 2. A new biomarker allows early detection of non-small cell lung carcinoma. In a cohort study, preliminary analysis shows that patients diagnosed with this new test appear to survive 3 months longer compared to those diagnosed using conventional methods. However, a secondary analysis shows no difference in 6-month mortality between the 2 groups. What explains these findings? The correct answer is lead time bias. Lead time bias occurs when earlier detection of disease gives the illusion of increased survival time without actually changing the course of the disease. Patients appear to live longer simply because the diagnosis was made earlier, not because treatment improved outcomes. To determine whether a screening test truly improves survival, researchers must compare mortality rates and follow patients for longer periods. In this case, the lack of difference in mortality confirms that there is no true survival benefit. Case 3. A 62-year-old man with diabetes, hypertension, and hyperlipidemia presents with chest pain, nausea, vomiting, and diaphoresis. Electrocardiogram shows ST elevation in the anterior leads, and cardiac enzymes are markedly elevated. Researchers design a randomized controlled trial to test whether a new drug, drug B, reduces mortality compared to standard treatment. They want to ensure that if a true difference exists, the study will detect it. Which parameter should they maximize? The correct answer is 1 beta. Statistical power, represented as 1 beta, is the probability of detecting a true effect when it exists. A study with high power reduces the risk of a type 2 error, meaning it minimizes the chance of missing a real difference. Power depends mainly on sample size and the magnitude of the effect. Therefore, to reliably detect a difference between treatments, researchers aim to maximize statistical power. Case 4. Researchers conduct a case control study to evaluate the association between pesticide exposure and head and neck squamous cell carcinoma. Controls are matched to cases by age and gender. Exposure status is determined through interviews. The odds ratio is 7.5, with a 95% confidence interval from 2.3 to 14.8. What factor most likely affects the validity of this study? The correct answer is misclassification bias. Misclassification bias occurs when participants are incorrectly categorized regarding exposure or disease status. In case control studies, especially those based on interviews, recall bias is a common issue. This is a type of differential misclassification. Patients with disease are more likely to remember past exposures than healthy controls. In this case, patients with carcinoma may recall pesticide exposure more accurately, leading to an overestimation of the association. Case 5. A large prospective study examines the relationship between alcohol consumption and breast cancer. 4,000 middle-aged women are enrolled. Alcohol consumption and cancer incidence are assessed through periodic questionnaires. After 5 years, the relative risk is 1.32, with a 95% confidence interval from 0.90 to 1.85. However, 800 participants are lost to follow-up, most of whom are moderate to heavy alcohol consumers. Which bias is present? The correct answer is selection bias, specifically attrition bias. Bias refers to systematic error that affects study results. In prospective studies, loss to follow-up can distort results if it occurs unevenly between groups. In this case, the loss of higher-risk individuals may underestimate the true association between alcohol and breast cancer. This may explain why the confidence interval includes 1, indicating no statistically significant result. Case 6. An epidemiologist wants to study hepatitis C transmission in a setting with limited resources. She has access to a group of adults newly diagnosed with hepatitis C and a group of hepatitis C negative adults matched by age. She plans to conduct a case control study. What is the most appropriate measure of interest? The correct answer is the frequency of past blood transfusion in each group. Case control studies select participants based on disease status and then look backward to evaluate prior exposures. Although the term cohort is used, this is not a cohort study design. Because case control studies are retrospective, they cannot assess future outcomes like incidence or risk. Instead, they evaluate past exposures that may be associated with the disease. In this case, history of blood transfusion is an appropriate variable to analyze. If this video helped you understand these concepts more clearly, make sure to continue with the next cases to reinforce your learning and build a stronger foundation. At Easy Medicine, the goal is simple: make high-yield medical knowledge easier to understand, easier to remember, and easier to apply. If you found value in this content, consider subscribing and following the channel for more case-based reviews designed for Step 1 and clinical practice. And remember, this content is intended for educational purposes only. I'll see you in the next video.